take some questions from the audience here. We have just a few minutes to do that. But using my privilege, I have one question. So AI can only work if the data is labeled and the data is shared, right? So you collaborated, for example, with the two hospitals. Are hospitals willing to share data across at a national level?
So in the AI, there are two processes. One is training process. There, yes, you need to talk about annotations, labeling, because the model gets trained. There we do share prospective data, which is anonymized. It's not patient-related data. But in the clinical practice, still, once we build the algorithm is deployed somewhere in the cloud, you still send normal patient data. It's nothing annotated, normal. Anybody sees, like ophthalmology sees a normal image in a monitor, the same image you send. But of course, when we send to AI algorithms, we remove all the patient information. We just send the plain data. The algorithm runs it to the clinical to the process and just gives the report back. So from the clinical perspective, it's all the same. From a training perspective, yes, there are some annotations and do things. From perspective of sharing data, yeah, if the challenge we have in India is that not many people have data. But these two examples why Google was comfortable because they had data for close 15 years. So these specialty hospitals believed in data from day number one. So they had data, so it was easy for somebody like Google to come and take the data, run their models, test it, and provide some kind of Indian-specific success rates.
Another thing I'd like to point out is that research institutions in developed countries like the US in particular have a lot of data that they've been able to gather through their relationships with industry and so on. Of course, anonymized data and so on. But these have become very valuable tools to further the cause of AI. I haven't seen something like that in India yet, and I'd love to. I'd love for industry and academic institutions to collaborate to create repositories of data that'd be really useful to take some of these ideas forward.
Any questions from the audience here?
Actually, the question is to Dr. Bharati and the team.
Can you speak a little louder?
Oh, okay. My name is Sridharan. I'm from San Francisco. So I'm your close friend. Those days when you started IT, the major challenge for us was the customer was far away, 12 hours from India time and 12,000 miles away from that place. But we satisfy the customer. You worked very hard in NASCOM and went through so many challenges. Today, it is a reverse process. Customers are close to Bharati, customers are close to all of you. So how really you are going to take care of those customers? Because far away customers, we are worried how to fix the problem. So we are working very hard in those days. Today, customers are pretty close to you. I want to know whether you are able to give the complete treatment to the customer. I'm not talking about AI. My company is the AI company, but I want to know the quality, how you are going to achieve. Because the technology is next to you, customers are next to you, how are you going to achieve?
So the quality, I mean, from my experience, I'm not a doctor, so I can't speak much about the quality. But wherever we apply, we ensure that proper testing, validation is done in the AI algorithms. Second thing, it's not that we allow AI to take decisions when it comes to treatment. We always substitute that with some kind of a clinician at the end point to decide what is the next step. So probably that could be my response.
Also like to add that you talked about customers getting closer to the provider, which automatically implies that the provider should know a lot more about the customer. And when you know a lot more about the customer, you can personalize the experience, which really means you can come true to the statement of customer is king. If you want to do that, you really have to understand the profile of the customer really, really well.
Yeah, so I think both the questions came out with one clear conclusion, that if you're going to use AI or give this service, you need data. If you talk about background, so I think health records, which we don't have sharing, and hopefully the Privacy Act that the government is coming out with will solve that issue. But I think one message, I think, to this whole group is let's start preparing how the data is going to be shared. Because if there's no data, there is no AI, right? So it's not an equation which can work. One last question, please. Yes, please, the lady here.
Yeah, hi, I am Neha. I work with one of the global healthcare giants. So I want to understand my interfaces with government setups. So AI, machine learning, Internet of Things, all things said and done, being in private sector, we are at a high-end advantage. But plethora of data lies in the government setups, in the hospitals out there. So how do we see all of this with the interface with government programs in a government setting? Because the load of patients, the load of issues is much more higher out there. One, so my specific question to Shri Som Mittal sir and to Mr. Ranga Shetty, that how do you see in the realm of Ayushman Bharat coming in and NCD screening being one of the prime impetus of the government pan-India? So how this could be amalgamated with our existing programs in a government level setups? Private can always do it and is all the way capable of doing it. But concern here is in the national healthcare programs and state programs. Thank you.
So I think you did answer the question in your, answer some of the points in your question itself. So I don't think I've ever seen before the involvement of government as much as we see today. So connecting healthcare with AI is a very big initiative, whether it is through Ayushman Bharat. So today there is an AI policy coming out, AI centers are being established by the government. And I think one of the first key areas that AI is going to focus on the government is healthcare. And I think it's a stated objective. But it's a big change that we're talking about, because if you look at it, even in private hospitals, when we tell the doctors to enter everything, right, they sometimes shudder because our systems are not as good. They spend some time. So I think the technology has to make it very easy for the doctors to be able to get the data and the data to be stored and shared. So some of the fundamental changes are happening. Today, privacy is a big issue which is getting sorted out. I hope the Privacy Act comes out. But we still have to work on the issues that you raised, because majority of the data does lie in the government hospitals.
See, in 2007, I filed the application for the International Award for Government of Gujarat. 2007 is 12 years back. They implemented TCA software of hospital information systems across 32 government hospitals. And the same ideology the government is implementing. What is not there is the act implementation and a uniform platform. The data is available. In next 4-5 years, we will be #1 surpassing China. Because if I give you an example, a radiologist keeps his data in tapes and disk that only needs to be copied, configured, indexed, and has to be analyzed. So the pool is available once the platform is there, and a recognition to those people there for their patents and their studies, we will have a lot of developments.
Yesterday, I had the opportunity to visit the Health Tech Incubator here at IIT Madras Research Park. It was an amazing experience. And I believe this is a perfect platform where data from public sources, from government sources, can actually be brought into the incubator to help entrepreneurs work on their ideas and use the data in collaboration at this incubator. So I hope we'll be able to build more such incubators around the country. IIT Madras has set a great example, I think, for us to emulate.
Thank you. Thank you very much.
Can you have a big applause to the panelists here?
Can I request the co-chair, and the speakers to please come here, please?